Alrighty, so we're going to be looking at imagery and imagery research and how this is used to improve performance, how the research has changed over time. And you're also going to get a chance to think about how you could use it as well in your own life. So it could be in your work, in your education, or in your daily life, in your hobbies or sports, if you do them as well. Has anybody heard of imagery before, or does anybody use it currently? Or it's sometimes referred to as visualization as well. So visualization or mental imagery. Yeah, somebody's hands. Marius, you've heard of it? Yeah. Do you use it in your work or your daily life or hobbies? Okay, we have time. Don't worry. If you can't unmute, you can type in the chat. I might have asked you a question too soon in the session. So a lot of people use this in many different professions, even in the medical field. It's been used for many, many years. And if you find this really interesting, there's a whole body of research just on mental imagery, and you can find that, you can read lots of articles on it and see how you can apply it. And it's not just applied to sports, but applied to many workplace scenarios, and especially in things like surgery as well. Okay, so put basically, imagery is essentially just using your imagination to see yourself performing in a situation. So all of us do this anyway, day to day. We see ourselves performing in a situation. It's more ideal to visualize and see yourself performing well in a situation. If you keep imagining yourself performing poorly at something, that can be demotivating. Okay, so if you find that happening, if you're imagining yourself performing poorly at something, it's best to find a way to distract yourself and to move away from that. Okay, so the ideal way to use mental imagery, which is used by psychologists or any workplace professionals, is to imagine yourself performing successfully, so doing something well. And when we do imagery, when we engage in imagery, so again, imagining ourselves doing something well, we use all of our senses. Okay, so all of our senses, we're seeing, we're hearing, we're feeling, we're even sometimes tasting, but it might not be as relevant to the situation. Okay, so it's used by performers, as I was saying, in a range of environments, such as the medical professionals in surgery, elite athletes, coaches, actors, people recovering from injury, people recovering from PTSD. There's a huge, huge body of research out there that you can read if you find this interesting, and hopefully you do. So moving on to different types of imagery. So as I was saying, all of us will have done some imagery growing up, whether it was more informal as we were children, we might have imagined ourselves receiving something fantastic, having a really good time. That's basically, put simply, that's what imagery is. But the research has moved on to a more formal approach to research, to imagery. And the first type of research on one of the approaches which worked well was the PET-LEP approach. Okay, and this was put forward by Holmes and Collins. And this is after a huge body of research was done in the area of mental imagery. And PET-LEP, what that stands for is the P part is physical. Okay, so when you're imagining yourself doing something, it's that you have the same equipment and the same clothes, for example, that you would have in that situation. The environment, we'll talk a little bit more about that soon. The task, timing, learning, emotion, and perspective. Okay, so I'm going to go into them in a little bit more detail in a second, but I'm just going to come back and talk about the progress in terms of PET-LEP research. So this has been researched and reviewed again since 2011, and it was found that it was an optimal approach than just casual imagery. So just casual, informal imagery with no real structured approach. And that's why the Pet Lab approach seems to be the optimal approach to imagery. Does anybody have any questions so far? Has anyone heard of Pet Lab before? No? Okay, so I'll tell you a little bit more about Pet Lab. But let's just move on here. So if we look at Pet Lab, when we talk about the physical, this is, if we're talking about athletes, for example, the athlete would use similar equipment when they're imagining themselves. So they're imagining themselves with similar equipment and wearing the clothes that they would be wearing then. If it was a doctor, for example, and they're imagining themselves performing surgery, they would imagine themselves wearing the clothes that they would be wearing, or they may actually be still wearing the clothes that they would be wearing performing surgery, holding the implements that they would be holding as well. Okay, so it appeals to the physical senses there. Then the environment. So when somebody is imagining an environment, they imagine the details of the environment. For example, if it was a doctor's surgery, they might be imagining the people there, the sounds that they could hear, what they could see in that place, where the chairs are, for example. If it was an athlete, they might be imagining the area, so the playing field, for example, or if it was a swimming pool, they could imagine the lights, the length of the pool, the colors, that type of thing. And the task. So the elements of the task are included in the imagery. So again, like if somebody was performing surgery, they would be thinking about each stage of the task as they go step by step by step. Okay. And we'll talk a little bit more about imagery scripts as we go on. And for example, if it was somebody performing a task, like for example, a swimmer diving, or if they're learning, trying to see themselves performing an optimal dive, they might see themselves performing each part of the task really, really well. The next part then is timing. So timing, this is an important bit, and it's a bit that's often missed when people are engaging in imagery. So the imagined experience should be in the same time as the real one. Okay, so sometimes when people do imagery just casually and at home, they might just imagine themselves performing a task, but they might imagine themselves doing it much faster or much slower than how they would normally. Okay, and the body can't relate to that as well. So it's about building up a neurophysiological memory in the body. So the body, it's a type of performance that you can do when you can't actually do the physical training, but it has been shown to have almost the same effects as physical training. Okay, so it prepares the muscle memory in the body for the actual situation. But that's why the imagined experience should be in the same time as the real one, to create that muscle memory, so that when you get into the real situation, your body is already familiar with performing the task. The next bit is about learning. So update scripts. So as performance improves, it makes sense to update scripts. So for example, if it's somebody learning a skill, as the skill improves, you can add in more details, okay? In the earlier stages, for example, if you add in too many details, this might create a cognitive overload and make it difficult for people to imagine the situation happening. So as somebody improves, and especially if this is working with younger people, younger children, you could add in more details to match with somebody's performance and their progress as they improve and get better. So then the emotions should be included, okay? And as I was saying before, it's important with imagery to imagine a positive and a successful experience, okay? So if there's negative imagery, this can have a demotivating effect and has a negative effect. So what can happen people sometimes is they might imagine a scenario that they don't actually really believe in, or they don't even have the skills for yet. So in that case, what happens is they start to say, actually, that's not possible. So they imagine it not working out. Okay, so when somebody is creating an imagery script, they need to create something that's believable, that's achievable, so that their body will also believe it as well, and they won't create some negative emotions when they're doing their mental imagery as well. So it's something that they believe that they can achieve and that they can associate positive emotions with it. Okay, if somebody, for example, starts to imagine a failure, repeated failure, this can have a demotivating effect and actually turn them off imagery altogether. So this can happen sometimes if somebody has had a period of failure in something. For example, something might have gone wrong in the workplace, or something might have gone wrong in a performance in sports, or any kind of arena. It could have been doing an interview or any situation where people are performing. And if they start to imagine this happening again and again, this is demotivating. So this is the time to recreate that imagery script into something believable and achievable. And then the perspective is whether the person is looking at themselves or from themselves. So this is a situation where you might be looking at yourself doing the task, or be in your own body performing the task. Okay. And this is situation, situation and task specific. So for example, this might be more important in certain sports. For example, gymnastics. It might be more important for somebody to look at themselves in gymnastics because they may be standing on a beam and the actual spatial environment around them is more important. If somebody is performing a penalty kick in a sport, it may be more important for them to be in themselves and imagining themselves performing the penalty kick. So you can do it from two different perspectives. Also, if somebody was performing surgery, you could use both perspectives. So you could also be looking at yourself performing the surgery and see yourself doing it successfully, and then also be inside yourself, feeling what you're doing while you're performing the surgery as well. So perspective is important. And I'm giving two examples of sports and surgery, but this mental imagery can be used in many, many scenarios. Okay, so it can be used in anything. It could be giving any type of performance, acting, singing. It could be teaching. It could be working in a shop, for example. Somebody's imagining themselves doing really well with customers, doing really well with their communication and that type of thing. So all these types of scenarios, it does work well with. But the bulk of the research has been done in the medical area and sports area as well. So this is a large image which comes from the BASIS expert statement, which was produced in 2013. And it basically brought together a lot of the research in terms of imagery together, including the PET lab approach, and brought all these recommendations, which I realize are not so easy to see. So I'm going to go into these in a bit more detail in the next slide. Okay, next couple of slides. Does anybody have any questions so far? Is anybody lost? Is everybody following?
We're doing just fine, I guess.
Okay, okay. If anybody is stuck or they're not sure what I'm talking about, what PET lab is or mental imagery, please ask. Away, is it? I just saw a hand up there.
Away, I saw Away's hand up. I'm not sure whether Away is still around with his hand up. Let me see if I can relocate Away. No, apparently Away has lost the connection. The hand was up very briefly. So I guess you may continue with your presentation.
Okay, no worries. So if we go into these in more detail, there is a lot of areas here. So it might help you if you jot some of these down, because there's a lot of different areas that are covered. So if we look at modality, so modality talks about being multimodal, which means using all the senses. Okay, so using the most relevant senses. For example, if it comes to a situation where you don't need to really imagine the taste of something, you don't really need to worry about that. What would be the most important sense to imagine? It could be the sense of touch, it could be hearing. Sometimes people, if they imagine too many sounds, it could be demotivating. So it has to be specific for the person as well. Other people may like to imagine the sounds that they can hear as well. They might like to imagine everything that they can see, the lights, the people, that type of thing. Okay. And then if we look at temporal equivalence, so what temporal equivalence is, what we spoke about before, is that it should be timed to the actual task in real time. I don't know if any of you have done practiced imagery at home before, but you may have found this difficult to do. I certainly find it sometimes difficult to time a task to the same time as it needs to be performed in real time. So it's something that you kind of need to focus on. And we'll talk about how you could do that as well a little bit more later. Has anybody tried to do mental imagery at home or want to talk about that? Or even in sports or any kind of scenario?
Remember, dear participants, you should not be shy. You may be very free to jump in and make comments and ask questions. This is something that the presenter is allowing us. Oh, wait, go ahead now. We have you back.
Hi, Owe.
Hi. Yeah, thank you so much. First of all, I'm sorry I wasn't here initially. I wanted to get a proper concept of the definition of imagery, because I was having internet connection before I joined in. Then the last question you asked, yeah, I've tried to practice. I didn't know it was called imagery, but I tried to see how I can perform tasks to time. You know, I time myself, like say, I'm going to finish this in the next 30 minutes, but I found that it is practically very difficult to get things timely done. And I will be grateful to learn from this lecture, how is it I can get my assignment done in 1 hour, 30 minutes? How can I be a master of it? I'll be very happy. But the question, I didn't get the beginning of the lecture. I'll be glad you can just use few words, just give me an introduction so that I can follow up. Thank you.
Yeah, so what we're talking about is using mental imagery, which is using all of the senses, like your mind, your eyes, your hearing, to imagine yourself doing a task well. Okay. If you're talking about something like doing an assignment, there's a number of different factors in it. So it may not apply as well to doing an assignment. So you could imagine yourself doing it well, but it may need to be a case of looking at all the factors that are involved in the assignment. Do you need more information? Do you need to break down the time that's needed to do it a little bit better? So something like doing an assignment can be a little bit harder to engage in mental imagery for. That may be a case of actually breaking down the time needed to prepare and each stage of the assignment and getting some support with that one as well. But something like, for example, doing a presentation or doing an exam, so something where it's performance pressure and you're actually doing a task, that may be a little bit easier to see yourself doing it in the right time and see yourself doing it well. You could imagine yourself doing an assignment well, but the practicalities of it are that you would need to see all the different stages that are needed. So is it that more information is needed? How much time do I need to spend on the start of it? How much time in the middle and how much time on the end? So it's a little bit different in terms of imagery and writing an assignment.
Sarah Lumbala. It's your turn now, Sarah.
Hello. Yes.
Hi, Sarah.
Hi. How are you there?
Good.
I'm Sarah. Yes, I'm in Zambia, southern part of Africa.
Lovely.
Yes. So I just wanted to respond to your question. When you said, have you had images? I just wanted to say, normally when I have a task, what I normally look at, I normally have this situation where I have to think of the goals and the outcomes before I even think of, the goals and the outcomes before I even think of writing down. And when I have that in my mind, it helps me to start having some tasks that will have me to reach those goals and tasks. So I don't know whether those are images, but normally I focus at the real situation to say, how am I supposed to achieve this goal and task before I even write down? So it helps me to plan. It helps me to process the ideas and ask here and there. I don't know whether those could still be mentioned as the images, or
that you're spot on, Sarah. That's really well. That's actually part of the imagery process. So that's something that we'll talk about later. So that's a really good point. Well done.
Thank you very much. Okay.
So
there is external. So after external question or comment, I would recommend you proceed, Barbara, with your presentation. If now
that's
external
perfect.
is ready. Jeffers Tobas.
Michelle?
We are losing that participant. Just go ahead there, please, Barbara.
Yes.
No problem.
Good morning.
Okay, she's now back with us.
All right. Unfortunately, I'm not able to share my video at this time.
That's fine.
I am from Trinidad, and I am a special education teacher. And I have never heard of this particular concept, but I am trying to see how this could apply to my students who would have impaired senses, because I think that a lot of it imagery applies to the senses, and technically my students are not in charge. I'm looking for a better word, but I can't get it at the moment, of actually 100% of their senses that may be necessary for me to use this to help them to be the best that they possibly can be. So I'm hoping that as we go along, I might be able to
think about it
from this.
Yeah, that's actually a really, really good point, and actually a good point because a lot of the research hasn't been done on people who have disabilities. So I think it would be a case of adapting. So what abilities, focusing on the abilities. So if they have the ability to hear, for example, is there something that could be done there? It may be something that an imagery script is created for them, so they can hear something and process the imagery script that's created for them. Or if they are very good at movement, just movement, for example, then they are walked through the actual action. So somebody helps them to walk through the action rather than them creating the script themselves, which it's something that we can think about as we go along. And I can come back to you and see if you've come up with something as we go too. So, okay, so the next one is imagery direction. So imagery direction needs to be facilitative. So we spoke about this a little bit before. So we need positive emotional imagery. Okay, so like I said, if somebody imagines a negative situation or a failure repeatedly, this doesn't work. This tends to create anxiety and more stress. So it needs to, when we create an imagery script, it needs to be something that's believable, that's achievable, okay, that won't create anxiety for the person, okay? And it should really come from the person rather than from a coach, for example, or as not so much from a mentor, but it should be done in conjunction with the person too. And okay, so if we look at activation, so the client needs to be alert and focused as if in the real situation. So we all know that when we're performing at a task, we're usually more alert, we're usually more focused. So if we're imagining ourselves doing that task, we need to imagine ourselves activated. Okay, so not like we're lying on our bed. Okay, so we imagine ourselves activated, ready to do the task as well. So because what this is doing is it's creating muscle memory in our body. So imagery works by creating muscle memory in our body, and we create that pattern. So when we continuously imagine something happening, then we create muscle memory in our body, and our body gets more familiar with it as we go into the situation. So what Sarah spoke about before is imagery outcomes. So Sarah was saying that she clarifies her goals and outcomes. Okay, this is really important, and it's a really important part before writing an imagery script. Okay, so you need to know what we want to achieve in this situation. Well, let's say, for example, if it was something simple like giving a presentation, the goal might be to speak more clearly. It might be a few different goals like that. Okay, so then before writing the script, you'd have your goals clear. Okay, so there isn't any incongruence between your imagery and between your goals as well. And meta imagery is recognizing that people are individual. Okay, so it's good to develop knowledge of people's own imagery processes. Okay, so it's not okay to say this imagery process works for one person, so it should work for everyone. Everybody has different ways of processing things. Okay, so that in the case of working in special education, for example, that's where we can respect everybody's individual needs, and they may have to have a unique imagery process. If they have more abilities in one sense area than another, that sensory area might need to be focused on a little bit more. So I guess in working in special education, it may need to be a more creative approach to using it, one that would work for that person. And the next one that we have is imagery ability. So this is an interesting one because the research has shown that some people have low imagery ability and people have high imagery ability. So some people just aren't as people tend to gravitate towards one psychological skill more than another. So it's a good idea to get an idea of how people use their imagination. So I'm sure some of you here are more in favor of using your imagination than others. Some of you find it difficult to imagine scenarios, and that's okay. That's just how people are. So if you have a lower imagery ability, don't give yourself a hard time about it. Okay, just work within the area that you can work with. And if you don't like it, if you don't like the approach, that's okay. Okay, just because it works for some people, it doesn't have to work for everyone. So, all right, so let's look at the expertise level. So it may be more beneficial to elite performers and skilled performers. So some of the research in the medical area recommends that imagery is used with skills surgeons, for example, rather than people that aren't as confident in the profession. And the developmental stage. So imagery for children would have to vary. Okay, so it needs to be reviewed and it needs to match their cognitive development. Okay, so like, for example, imagery for children could need to be something very simple, like drawing a picture of a desired scenario and imagining that desired scenario. Okay, so that could be something simple that could be adopted. But children are extremely creative, so they might come up with something even more interesting. So if we think about periodization, so periodization is about the time of the season, okay, the event, the injury, the workplace, okay. So when is the right time to do imagery, okay? So usually pre-competition or pre-event is a good time to do it. It may not be good to do it in the 2 hours before it. Okay, so it's always good to think about the types of pressures and will it be relevant. For example, if it's post-event, it might not be as relevant, or a month beforehand, it might not be as relevant. Okay, there's also something where people tend to get burnout if they're using too much imagery. Okay, so if they're using imagery all the time, then they may get tired of it and not apply it as much. Okay, and then it loses its effectiveness. So imagery scripts. So what people do as well, so elite athletes and people who use imagery, they tend to write imagery scripts which are matched to their goals. And that's what Sarah touched on earlier. So the imagery script needs to be related to the goals and it needs to be reviewed regularly, because as you improve at something, then it's not as relevant anymore. Okay. The timing, as we mentioned, should be in the same time as how you would perform that in a real life as well. Okay, so, and then the last point, which is important here, is that imagery training sessions. So shorter imagery training sessions are advised, and they are best, according to research, if they're combined with physical practice. Okay, so you can imagine that in a range of scenarios. So any scenario where you're using imagery, it could be any type of performance, acting, singing, playing a musical instrument, for example, but you could do a short imagery session and then combine that with the actual performance as well. And the research has shown that in both in sports and the medical field, that's the optimal way to approach that. Are there any questions about that? Dr. Ribdi Asaidi?
Dr. Reddy.
Yes, good morning.
Good afternoon.
Good afternoon. Ribdi Saidi, Dr. Ribdi Saidi. Just, I want to ask a question. Is imagery imagery is subconscious mind? This is the first question. And the imagery associated with bad things.
Yeah, can you repeat that again? It's a little bit hard to.
Yeah,
it's a little-
there is an issue with your sound, Dr. Reddy. If you can.
Maybe type it.
Yeah. The first question is imagery. Is that subconscious mind?
Subconscious mind.
Yeah.
It's actually conscious. It's a conscious process. Okay. So even if you, for example, now you can imagine yourself doing something, it could be going to the shop after this. Okay. That's actually a conscious process, but it works neuropsychologically in your muscle memory. Okay. So it creates a memory in your subconscious then. Okay. But you are conscious of doing it because you're writing a script and you're physically doing it while you're conscious, for example.
Yeah, and it's the bad thing that imagery, because we are always remember the bad thing, and can stop or can change the rules.
So what some people do is they imagine a bad scenario and write out what they would have liked to have happened in that scenario and create a positive imagery script to cancel out the negative imagery script. Okay. So let's say, for example, somebody slipped as they were walking up to give a presentation. They might write out an imagery script and imagine themselves walking up really well, doing things really well, and things working out well for them. And that can cancel out the thing that went poorly for them. Okay, so they don't keep on recreating the negative imagery in their mind, and they can write out like a 15-minute script of things going well.
Stereo.
Yeah, good afternoon.
Good afternoon.
Yeah, I heard many things about the law of attraction. I'd like to know if there is one relation between the imaginary and the law of attraction.
Imagery is basically scientific research. So I know the law of attraction is something which it's not scientific based, but this is what I'm talking about here is basically scientific based. So it is usually when people are using it in a more academic form, they should have a more formal approach to it. And that's what the recommendations are here about it as well. Yeah, so I guess there are similarities, but it's what I'm talking about is mental imagery. Okay, so we'll finish with short imagery training sessions. So I'm just going to move on to show you some of the research in this area. Okay, so a meta-analysis was done on the effects of mental imagery in sports. And this is a recent meta-analysis. So the main points that came out of this was there was 55 studies which were used, which focused on imagery alone. Okay, and imagery combined with physical practice was the most effective. Okay, so when people used imagery, short imagery training sessions, and then a physical session, this was most effective than just imagery alone. Okay, so for example, you can imagine at times like COVID when people couldn't go out and couldn't perform then they might have been doing imagery at home, but actual imagery with combined physical practice was the most effective. And then imagery effectiveness improved with imagery intensity. Okay, so that's why all the specific areas need to be considered well as well. So considering the timing, considering the senses, making it believable, so that improves the imagery effectiveness. And then moderators could be things like low or high imagery ability, and professional athletes were not considered, for example. Okay, so that was in this particular meta-analysis. Okay, so those areas were not considered. Now, overall imagery has a medium effect on performance. And because the studies only included imagery, it would be considered valid. Okay, so they didn't focus on any other, these studies here did not focus on other forms of sports psychology support. Okay, and the approaches used varied. They varied with the timing that they used and the sensory modalities that they used as well. But overall, from 55 studies, there was a medium effect on performance, and it was most effective when it was combined with physical practice. Okay, are there any questions about that? Simon, I think you have a hand up.
Simon Checker. Simon is trying to connect to audio. We are patiently waiting for you, Simon. What about Hussein Iran?
You're muted, Hussein. I think you need to unmute.
Yeah, I'm trying to do that, but if okay, he's on.
Good evening.
Good evening.
Hello.
Good evening. Thank you very much for the session. I'm Hussein Salesa from Kenya. Actually, too much of everything is normally poisonous. Is it true that most of the mental disorders involve systemic imaginary?
That's a
Actually,
funny
as a result, yes, as a result of stress, these other disorders and the likes. Yeah.
It depends what the person is imagining. So, if they're going into obsessive thinking and negative thinking, yeah, of course, that could end up being a mental disorder. That's why the imagery needs to be controlled and positive and facilitative as well. So positive imagery that helps people rather than debilitative imagery.
Thank you.
You're welcome. Okay, Simon, did you want to ask a question? No? Okay, so we'll move on to mental imagery in medicine. So I don't know if anybody here works in the medical field, but you might, maybe perhaps if you're don't work in surgery or anything like that, you might talk to somebody who you know might work in surgery and see if they've used this before. So it is quite popular. So basically what will happen is people who are performing surgery, they will talk to, so a team of surgeons, for example, will talk through what they're going to do step by step, and they'll imagine what's going to happen step by step as a team, usually. Not usually one surgeon by themselves, but as a team. So just to look at some of the research, the patients, this particular research is in relation to patients. Okay, so patients who used imagery pre and post surgery had shorter stays. Okay, so that's shorter stays in the hospital. They had less anxiety and they needed less prescriptive pain medication. And also patient satisfaction was maintained. Okay, so it's also seen as like a cost-saving method as well. We have lots of hands up here. So who wants to ask a question? Let's see. Somebody who hasn't had a chance to, Chris Edmund?
Yeah, good morning in America.
Good morning.
Okay, my question is, I'm just getting a little bit confused. I need some clarification. Does this have something to do with clinical?
With what type of clinical?
clinical psychology?
No, actually, it's actually not something really that's majorly studied in clinical psychology. It's something that's studied a lot in sports psychology, but it's the research also, it's used in the medical field. So mental imagery is also used in the medical field, and they will do research on this as well.
Because I'm asking because I'm doing clinical psychology since some of the things and what I'm studying, and later it go out of it and comes in like research and core. So I'm trying to figure out something if in terms of imaginations and other also have something to do with behaviors and disorder. That's why I'm asking. Does it have something to do with it, so that I can know what to say? That's why I'm asking.
Yeah, it could. I mean, it could be used for people who have, behavioral issues as well. It would depend on the case, and it would have to be very individualized and, used on a case-by-case basis. So, but there is a huge body of research. There's a whole body of journals that are devoted just to mental imagery. So if you're interested in the topic, you can read more about them there as well.
Most of the things I've coming to across, you are talking about in clinical psychology. So if that is it cut across, like it puts hands in each other. In the case of someone having mental disorder, forgetfulness, and things to use to bring the person back to normal. You were talking about some of these things, so.
Okay.
Yes, so, yeah.
Very good. Okay, so is there anybody else who hasn't had a chance to ask a question?
Dr. Jane? Dr. Jane?
Good afternoon.
Good afternoon.
My question comes from a medical disorder. What are the main causes of mental disorder in women, mostly first giving birth?
It's quite hard to hear you, Dr. Jane. There's a lot of background noise.
Can you hear me?
Yes.
Okay, my question are the main causes of mental disorder in women, mostly first giving birth.
I can't, so I'm sorry, but I can't follow what you're saying.
From what I understand, Barbara, she's asking about mental disorder from people who have just given birth.
Oh, people have just given birth. Okay. Yeah. So that's something that we cover in this, I think the next piece of research we're talking about. So there is a huge amount of research on the use of mental imagery for people dealing with stress. So it has been shown to be effective for people who are dealing with PTSD as well. I don't know if there's any research on people who've just given birth, but if it's something like postnatal depression, there will be some research on that, more than likely in mental imagery. So that's definitely something worth looking into, and I would consider it effective as well. So, but like anything, if it's a clinical situation, if they may need something more clinical, they may need something more than just mental imagery as well. So yeah, does that answer your question?
We have lost her temporarily.
Okay.
If you want to take another question, we have other hands up, but we are approaching gradually to the end of this session. Let's allow real quick, let's see, Clameline Noel, if your audio is ready for us.
Okay, thank you for giving the floor this afternoon. Good afternoon to everyone present in this program. The data I have in my computer here is talking on mental imagery in medicine. I would like to find out from the presenter if a patient is seriously sick, admitted to be on theater and has a mental preparation, that means psychologically is well aware that the operation is supposed to take place. If after being in the surgery, you still have to go back there because of medical error, what could be the psychology of such patient? Or how could we manage the person psychologically?
Okay, I didn't completely follow that. I couldn't hear you fully either.
I'm
Can you?
asking.
Yeah.
We are talking of mental imagery in medicine.
Mental
As
imagery
a
in medicine, yeah.
patient, yes, a patient is prepared psychologically to go to the theater because his health is very clear. And
Sorry,
after the first,
patient is preparing to go where?
to the theater. He has to pass through surgery, yes, to the theater for operation.
Yeah, yeah.
So after that first action, they discovered there was a medical error, and the patient supposed to go back to for another surgeon. How can you prepare such person's psychology, and how will be the psychology of such patient?
Yeah, yeah. So
thank you.
What you would be dealing with there is PTSD. So somebody is dealing with stress, and so in that case, mental imagery would help. But if they keep imagining a scenario that was negative, that may be more problematic. So they may need some support with it as well. Okay, so if, for example, they're trying to write an imagery script, but they keep imagining things going wrong, then that could create more anxiety. That's where imagery is, we need to be careful with imagery. Okay, so if we're writing down an imagery script and it's, oh, things go wrong, they make a mistake and everything is bad, then that's actually going to demotivate the person. So it needs to be something that's believable for the participant. Okay, and if they can't create a believable imagery script, maybe they need some support. So maybe they need family members, or maybe they need some staff in the hospital to support other people, things like that. Okay, so it's a good point. It's not a very simple solution. There are nuances in life. So yeah, very good point. So I will move on just in case we don't get everything covered. But if we have time at the end, I'll definitely be happy to answer questions as much as I can. So yeah, so if you look at more mental imagery use in medicine, so this is a review of the use of mental imagery over the years. So like I was saying, it has been used a lot in medicine. And for this 474 participants were used. Okay, so these were surgeons and medical professionals. And there was 9 randomized controlled trials. And it showed that imagery was effective when used with physical training and skilled participants. Okay, so this was combined mental imagery. So they were using it in conjunction with the actual physical practice and with skilled participants. Okay, so that might even touch on what you were saying, Danieline, I'm sorry, that you know, imagery used with skilled participants, and this is actually the medical professionals, okay, is effective. All right, so let's move on to imagery used in the workplace. So we have one of the earlier pieces of research. So as you can see, this has been done for a very long time, mental imagery. And so here it was proposed that mental imagery and self-talk could be used to improve individual and organizational performance. And then if we look at the more recent research by Lee et al. So in this piece of research, there were 35 participants who were experiencing work-related stress. And what they got to do was they did 15 minutes of imagery practice 4 days a week for 4 weeks. They tested them with a questionnaire pre and post intervention. And they showed that they had reduced anxiety. So some of them had generalized anxiety disorders, depression, and PTSD scores. So these were reduced post-study. So in this, they used a combination of mental imagery and things like mindfulness, breathing, and they had some things that they were listening to as well in this. But the purpose of the study was to focus mainly on mental imagery. So this was considered successful, a successful approach for mental imagery. Okay, so we're moving on to the last part here, and then we'll have time for questions, okay? So just to give yourselves time to relax, I'd like you to imagine a skill that you will perform. So it could be anything at all. It could be, you know, it could be teaching class, it could be doing a sport that you enjoy, anything that you do which is performance related, okay, playing a musical instrument. And I just want you to close your eyes, relax, and imagine yourself doing the skill well, okay? Make it believable, make it something that you believe that you can do, something that you want to do. Has everyone got something? Okay, then imagine what you are doing. Try to time it in the time that it takes you to do that actual skill. What do you hear? Do you hear some encouragement? Do you hear clapping? Is there anything you can smell? Is it relevant? What do you see? Okay, and then imagine yourself doing the skill in the time that it takes to complete that skill. Imagine yourself being activated, so being focused and alert, like how you would be if you were completing that skill. And keep the imagery positive. And if nothing, just notice the effect that that has on your body. Does anyone have any reflections from that? How did people find that?
I don't know, Masubi, Mashi, if you want to ask a question or make a comment.
Yes, it's a question.
Go
Good
ahead.
afternoon.
Good afternoon.
Good afternoon. I'm
Good
calling
afternoon.
from, from Nigeria. I want to know where is the place of imagery in counseling? How can I use imagery in counseling a client? Counseling
okay.
a client.
Yeah, sure. So counseling a client. So just as one example, so for example, imagine a client comes to you and talks about a situation that didn't go well. Okay, you could ask them how you would like it to have gone. Okay, and then ask them to talk you through it going well. Okay, so imagine the situation going well. What would it look like? Okay. And this isn't to minimize the situation that they might have experienced, okay, but just to offer another solution so that it doesn't have this hold over them and it's not consuming them, for example. So it could even be that they write it out and that it's a short script, 5 minutes, 15 minutes, but it's something that they can imagine going well. And like I said, it's not to take away from the fact that something went badly, but just that they have another thing, another focus that can take the focus away from the bad situation. Does that make sense?
Yes, thank you.
You're welcome.
Thank you.
Any other questions?
We don't seem to have any at this time, so you may proceed, Ms. Hassett.
No problem. So we're on to our reference list here. So this is the references that we used for this presentation. Now, as I said, if you find this interesting, there is a huge body of research in this area. So you might want to go to the medical journals and look at some of the medical research, and then look at the sport research and see how you could use it. And then also there is also research in terms of other workplace scenarios dealing with stress. But one good way to start, or one area to start from, is looking at PetLab. So that's what we looked at earlier in the presentation. Okay, so then also you can look at the BASES statement. So this was here, the BASES expert statement. Okay, and all the areas of that. And then consider the recommendations. So the simple approach that we did at the very end was just using some of the senses, imagining something which is believable, okay? And also, oops, sorry, I'm going backwards. Okay, so imagining something that's believable, that's timed in the right time, that's activated, so your body's activated and focused, like in the actual scenario that you'll be performing. you use the senses, but you don't have to use all the senses, just the most relevant senses. And then it's also best when it's combined with physical practice, okay? So maybe if it's about going to do an interview, that you imagine yourself doing the interview well the morning before you go and do it, okay? And then you're going to do it, okay? Or you could do some physical practice of the interview, okay? So you can actually imagine yourself doing the interview well, and then also do the interview in front of a family member or friend as well as practice, okay? But that's a way to use mental imagery. So we have time for a couple of questions if anybody wants to ask anything.
It is your time now again, ladies and gentlemen, and we're gonna start with Sydney Ben. I looked at Sydney Ben's hand up momentarily, but Sydney seems to be gone real quick.
I see Sydney. I can see him. Yeah.
Okay. Go ahead, Sydney.
I think you're muted, Sydney.
Let me see. I don't see Sydney on my end. What I would recommend, Barbara, if you would remove your PowerPoint so that I can locate Sydney real quick and eventually allow him to, there we go. Go ahead, Sydney.
Still muted.
Yeah, apparently it is Sydney's audio settings that prevent me from unmuting him. Okay, there we go. No, we still can't hear Sydney. Sydney, please double check your microphone. Your microphone might be off, even if I try to turn it on my end. No, that is not working at all. Let's try.
You can type the question.
Yeah, you can type the question in the chat line, but let's try Chantal Van at this time. Let me see if Chantal cannot be unmuted. There we go. Chantal is okay. Go ahead, Chantal.
Good afternoon from South Africa.
Good afternoon.
I've seen some of the presentations, and it's really been very, very informative and learnative from my side. I'm a school psychologist, and I think with the mental minders, it is perhaps a very, very good thing to use when preparing for examination, especially with children who have barriers to learning and that get special concessions. For example, scribing, reading, extra time, or other disabilities that might be a break in the time of the question paper and so forth. So the preparation beforehand gives me a lot of good points to work with those children before going into an examination paper by going into the mindset of a relaxation state and a focus state, and visualizing what is in front of them before they actually answer the question.
Do you find that it helps to reduce the anxiety?
It definitely helps to reduce the anxiety in the children. And I think it's something that that can be implemented in a broader term than in those specific learners that have a separate venue to write in during a class activity, maybe. We especially in South Africa, we work in primary phase, intermediate phase, and the intercent phase, which is just goes up to high school. So and then you have classes which have 35 to 40 pupils in. So that can maybe be helpful in that regard, as well as to doing it for an all-round activity.
Yeah, very good. Good to hear.
Lumbayi, Ilonga, your turn now, Lumbayi.
Hello, Dr. Babs, can you hear me?
Yep.
Yes.
Yeah. Thank you. Your presentation was so good. So my question just goes like this. What happened to a person when they want to go to gym or do some exercise and suddenly the brain shuts, like he doesn't want to do anything? So what causes that?
That's just demotivation. In those situations, it's better to do without thinking. So that's a different type of challenge than you could actually imagine yourself walking to the gym or getting in the car and going to the gym. That would be helpful, but if there's too much thinking, it's called a cognitive overload. So the cognitive overload is the thing that makes you stay inside. So rather than giving into the cognitive overload, it's better to just actually walk out the door without thinking, and yeah, not to let it take over.
Oh yeah, thank you so much for that.
You're welcome.
Paulette Williams.
Yeah, that's what I wanted. I said the bench shut. She was laughing.
Paulette.
Hello, good morning.
Good morning.
Yes, I'm calling from the Cayman Islands. How are you all? Good morning.
That's fine. Welcome again.
Yes, the presentation is very informative and insightful. I'm hoping to do more research to understand and broaden my knowledge. But there's a question I would like to ask. How do we apply this to students who are special needs?
Yeah, so somebody asked that question earlier, and I think it's a really, really good question. I think the focus needs to be on what the abilities are. So not so much on the disability, but on the ability. So focusing on what they can do and creating an imagery script that they can use. So it's within their ability. It may be adapting something that they can work with and creating it with them. It could be something simple, like if they love drawing, that they can create an image of something they really would like to do. If they're good at moving, for example, it may be walking them through something or running them through something if they're very good at running. Okay. So it depends on the special needs, but it's about trying to work out the strengths and the abilities and working within the abilities.
Okay, thank you so much.
You're welcome.
All right, thank you very much. You allowed time for 2 questions. We have had several, and we certainly are very thankful to you, Barbary Hassett.
You're very welcome.
If you would allow 1 or 2, I don't know, more questions.
I think there's one from Peter who didn't get to ask a question.
By the way, before we go to Peter, Sydney Ben seems to be on at this time, according to my screen. Go ahead, Sydney.
Good afternoon. I'm from Zimbabwe. I just wanted to ask, will mental imagery enhance children's capabilities of retaining knowledge or information? Because we have a problem with lack of retention by the children, especially that are writing exams very soon. So they are not retaining the information that they have been taught. So will this mental imagery assist them in retaining what concepts that they have been taught?
What I can relate that to would be that they have a mental imagery script which allows them to relax. So not that essentially that they are trying to retain the information through mental imagery, but something that helps them to relax so that they can then retain some of the information a little bit more. So if they have anxiety and things like that getting in their way, that may be harder for them to remember the information. So you could create an imagery script where they are relaxed, they're going into a scenario or an exam and they're doing it well, for example, and that may help them feel more motivated and more confident to do well. Does that make sense?
All right, let's make room for the last question from Peter Gaillet Forbes. If you are paying attention to us, your audio is on. It is your turn, Peter Gaillet. I hear a voice, but that's not from Peter. And I'm trying to unmute Peter. It doesn't seem to be working, and we are very, very sorry about that. So we've come, ladies and gentlemen, to the end of this very important session. As you all would testify, once again, we had a top-notch, world-class academic feast. I love to call these sessions academic parties because that's exactly what we had with Ms. Barbara Hassett, to whom we are all very grateful and thankful. Like I told you, Ms. Barbara, at the very beginning, at every presentation of yours, our audience is really having very, very impressive grades for you. Your presentation is usually in line with what Atlantic International University is trying to achieve, something that we do not get elsewhere in other universities. We are very, very thankful again to you. We appreciate everything that you've done to prepare your presentation and then to present it in so eloquent manner, so to speak. And we're looking forward to having you very soon again for similar presentations. If you want to have concluding remarks, Miss Barbara, that is on you again, your turn for the conclusion of your presentation.
No, thank you very much. It was my pleasure. I really enjoyed all of your questions and all of your input. So thanks everybody for being here. And thank you again, Dr. Balkan. I'll see you soon.
All right. Ladies and gentlemen, it's the end of this session. We are very, very thankful to each and every one of you. Your attendance has been key to the success of this class. The next appointment is tomorrow. It's every day in English tomorrow, 10 o'clock. Thank you very much and be blessed.
Hello,
Thank you.
Thank you. Bye-bye.
Thank you.